All right, this is Jay from Life for Rex, and today we're going to talk about lumbar area pain, lower back pain. And as you can see, this is really complex mechanism up here. This is our hip ilium, and this is attached our the femoral bone, which is we're walking. Now look at the spine. Is just amazing how the spine is contact to each other. This is L4 and this is L5, and we have a joints right here. And if our muscle, one group of muscle, one side become more tighter than other, which is the big possibility because we do the specific movements every day, every single day. You're sitting at the computer, you twist to the left, the muscle become inhibit on the right side, the left side has become really tighter. Some people do other pattern. This is all pattern. This is all program. Your brain send the impulse to which muscle really relax and what muscle be strong. Always in attention. Also, this is really important to keep these joints healthy. Most people do stretches, they do stretching, they twisting, and that's create more inhibition in this area, and it's going to be more problem. The more contact here, the more movements up here, the more damage. Sometimes yoga people, they have really crazy pain from like level 10 pain in the lumbar area because yes, those vertebrae, it's just been destroyed, and there's no jelly between your vertebrae. It's also the problem, but it's the way to heal the spine. It's the way to heal your spine. It's create a lot of muscle tissue, soft tissue around your spine, and balancing your hip. This is the goal. This is the goal to keep your spine healthy. So do not stretch, strengthening, and please look at those exercises. If you already have pain, start with the floor. Do not start with the progression, specific with the weights. Also, if you add a lot of nerves up here, you can just take a look what's going on up there. This is aliens. This is aliens. Look at that. Look at that cavity. So you have to. The most 80% of the problem in your body is just come from the spine health. So you have to keep your spine healthy. All right. So if you need help, call professionals, do those tests, and don't wait. If you feel pain in your lumbar area, this is already tell you something mechanically problem. If this is start shooting down, this is your disc. This is your disc, possible L4, L5, S1. It's all different sensitivity in your lower your body, in the foot, in the heel, on the side, in the glute. This is really important to get this health. Thanks for watching. Please continue with exercise.
Okay, and let's gonna do test before we do exercise. If you feel pain, sharp pain, you need to contact your professional physical therapist or your doctor and ask more questions about your condition. So the first thing first, it's a flexion. So we're gonna put our feet together, looking at our toe, and try to go ahead and touch our toes. If you can't touch it, that's fine. If you experience pain, just observe it, write this down. Where do you feel pain? What the movements. The next one is going to be extension. So you're going to place your hands on your hips and kind of try to do extension. And just see if you feel any pain. Maybe you feel pain on the left side and right side. It's really important to write this down. Okay. The next one is going to be single leg stance. Just see what balance, what hip is a problem. Because you start to get wobbling, that's what the problem is. And that's where you start stabilize the side. So I'm pretty okay, but I feel shaky in my ankles. Let's see my right one. And I believe I don't feel anything in my hip, but I feel in my ankle. So I need to work on my ankle. It's really cool. You observe what's happening with your body. You don't rush yourself. You just, pay attention, and you're going to find the answer where the problem is. Next one, this is going to be more specific. If you do feel sharp pain in your lower back, this is be really serious. Like I said, you need a contact. It's called stork. So you place your hands on the hip and you try to bend back and see how you feel. If you're wobbling, if you feel pain, that's the bell. That's the bell to call professional. Next one. And actually I feel a little bit kind of stiffness. Yeah, I feel it too. So I need to work on that. Maybe one of my vertebrae slide off and I feel this discomfort. push against that nerve. So I need to strengthen my core too. The next one is going to be floor angel and twist. So you're going to lay down on your back, make sure it's no space between your spine, it's completely flat. And what you're going to do, you're going to place your arms on the floor without breaking your spine. So most people start bending. You just stay up here and breathe. You're going to feel how your spine is stretching. It's really good with beginning the exercise. The next one is also test and exercise at the same time. It's called single Reg Raise. If you feel any clicking, that's fine. That's mean you're unbalanced a little bit. But the problem is if you do feel pain in your lumbar area and your lower back, that's mean L4 is in trouble. So you need to find out this and maybe adjust this L4 before you go and do this exercise, okay? So the next one is going to be called wipers. So we still place our hands right here, bring our legs a little bit wider than mat, and what we're going to do, we're going to drop to one side and flip to another. So look another side, I'm dropping to the left and look to the right and see how I feel. I feel a lot of restriction in my right side. So this is something I need to work on. Next exercise, it's called dead bug. You can do without band, but I love to do activate my upper body and my lower body together. So this is how I look without band. You do 90-90 and you just drop one arm, one leg very slowly. Just like that. You see I do cross, so I drop my right arm and left leg. You can try to do single one. This is going to be a little bit confusing. Just work on those progressions. Okay. But what I like to do, I like to grab this band, stretch right above me, hold it, and do the same thing. So I'm stretching to the side and also stretch forward. This is going to engage my core really good. Okay. So the next one, we're going to go in our quadrupedal area, and what we do, we work a little bit on flexion and extension of our spine. It's called cat and cow. What you do when you inhale and you try to look up as far as possible, and if you do feel pain in your lumbar area, which can be happening, just light up and go to this position when you do not feel this pain. It's really important. So, and breathe. This is the main idea of this exercise, breathing in and out. So, and pull your stomach in. Really great. Next one, it's Superman, dog Superman. So you're gonna go left arm, try to touch your knee with your elbow and go forward. And you can switch to sides. And the next one, you're going to be more standing now, so we can stand up, we activate our core. This is more progression now. So the next one is going to be more standing. Remember, we start on the floor. When we feel strong, when we feel active on the floor, we can stand up and do standing exercise. You can't start your rehab and recovery of your spine with a standing position. You can't put the gravity on your spine. The first one first, you can use the weight, you cannot, maybe not using the weight. And the first one, I like to use weight. I just hold it in the front of me and I walk. And you see, I'm also, when I go back, this is the challenge. So when I go back, I'm challenging not pull me. And you can go really strong. And when you return back, you feel this activation. So you activate your core. The next one, sorry, I'm gonna turn around. Maybe you can see from the back. And really great exercise. You're gonna feel those side muscles, those breathing muscle activation. Try to 5-6 times, it's gonna kill you in a good way. The next one, you can do chopping exercise. You can always chop, and most chopping is Yeah, you come and you just chop. You come close to your body first, and after you chop. You can walk with this. Okay, you can switch. Just see how you're gonna feel. Switch the leg. Just play with that. It's just as create this new muscle activation, new action in your life. Because trust me, you do the single movements all day long, and that's what the problem is. And next one, my favorite one, is called samurai. So one leg, you holding like a sword. So you'll raise one leg up, and you just moving your arms in front of you. You can do both. You can do single. See, that's what the band is really handy here. And it's pulling you, so you fight. You're gonna feel in your ankle, in your glute. This is what the muscle activation. You can switch, and it's really wobbly. You can see it. Always breathe. Focus with your breath. And that's how you pull it. Both. Next one, get more progression. You can get some weight and do airplane. You can use kettlebell. You can use barbell, dumbbell, sorry. So, and you just do single leg. You reach in front of you. It's really good for your hamstring. You're gonna feel a lot of cool stuff. It's a balancer too, as you can see it. You can switch and see how you're gonna feel another leg. I'm just observing because every day is gonna be different. So this is really cool exercise for your core stability. Please do them every day. You're gonna feel really strong. But just remember, start on the floor, do floor exercise first, and have to stand up when you feel stronger. So be happy. So be healthy, take care of your spine, live your life happy. Thanks for watching.